当然这些讲座都是围绕着美国的社会福利以及一些免费的或便利的社区服务。那现在我们开始今天的讲座，我叫彭丽萍，是今天的翻译。今天的讲座呢，计划是8点钟结束。为了更好的控制时间呢，大家的提问还是需要提交到 chat box 里面。当然中英文都是可以的。如果到了8点，我们无法回答所有的问题呢，我们还是会像上次一样的收集所有的问题，统一的在我们的微信群里面来回答。那现在我把时间交给Paula。Paula, time is yours.
Okay, good evening, everyone. Can I share my screen? Is it okay?
Yes. So, yes.
All righty. Can you see my screen?
Yes.
All righty, good evening, everyone. My name is Paola Vargas, and I'm with the Western Connecticut Area Agency on Aging. This is our second lecture that's being hosted by the Cheshire Cultural Diversity Association. I am with my colleague Daryl Willenbrock, and we will be discussing original Medicare versus Medicare Advantage plans, and we will just break down the pros, the cons, and just get into the details about which option might be the best option for you. All right. So what I will do today for today's agenda is we're going to introduce the Western Connecticut Area Agency on Aging, just discuss a little bit about the towns that we cover. We're going to have an overview of Medicare. An overview of Medicare, original Medicare, and an overview of Medicare Advantage plans. I keep clicking. We're also going to discuss the pros and the cons of original Medicare and Medicare Advantage plans. And then towards the end, we'll have about 10 to 15 minutes, and we will open the floor for questions that you guys might have. You can put them in the chat, and then afterwards we will answer them. So the Western Connecticut Area Agency on Aging is a private nonprofit organization. We are one of 5 area agency on aging, and we serve the Northwest region. We serve a total of 41 towns. As you can see, Cheshire is one of our towns, all the way on the eastern side of it, all the way towards the west towards Danbury, New Fairfield, all the way up to the north to North Canaan and Salisbury. I am with the Choices Department, which stands for the Connecticut Program for Health Insurance Outreach, Information, and Eligibility Screening. And what we do is we assist people on their journey when they're beginning Medicare or if they already are on Medicare. So if you're turning 65, we're the best place to call so we can help you before things kind of get tricky. And if you are 65 or older and you've already been on Medicare but you still have questions, we are a great resource. The Area Agency on Aging has other programs like Meals on Wheels, the Home Care Program for Elders, and there's a couple different programs. So if you know of a family member who might need assistance and they are in the 42 towns that we cover, please give us a call. We will provide the phone number on the last slide, so that way you'll know where to call.
Okay. Area Agency on Aging 呢，这个组织呢是拿政府拨款的非营利性的一个组织哈，这个是 Medicare 官方指定的一个咨询机构之一。这个组织呢在康有5个分部，这个分部呢他们都是有特定的这个服务的区域的。像刚才那个宝拉说的 Western Connecticut Area Agency on Aging 呢，他们的分管的区域呢在图上面的蓝色区域，一共有41个 town 哈。北至 New Canaan， 然后南至 Danbury， 然后东面到 Cheshire， 都是他们的服务范围。那么这个组织呢，它不仅仅有关于 Medicare 的咨询服务，它还有其他的一些为中老年人服务的项目。这些服务呢都是免费的。如果你65岁或者是65岁以下，你是残疾人士的话，如果你有这个咨询的需要的话呢，你都可以打电话给他们哈。这个组织不仅有 Medicare， 也有 Medicaid 的咨询服务，还有其他的一些，比如说家政的护理啊，预防针的咨询啊，送餐啊。 等等，那这些服务全部都是免费的。
So there are two options when it comes to Medicare. You have original Medicare or Medicare Advantage plans. Original Medicare comprise of Part A, which is hospital insurance, Part B, which is medical outpatient insurance. You would add a Part D prescription drug plan for your medication. Since Part A and Part B only cover 80% of the service, you would also enroll into a supplemental insurance plan, also called Medigap. That is the first option of Medicare. And when you turn 65, that is what you're originally enrolled into, Part A and Part B. The second option is Medicare Advantage plans, often referred to as Part C. Part C combines Part A, B, and D to be an all-inclusive, comprehensive second option of Medicare. It includes your medication coverage, and instead of having to add supplemental insurance, you would pay a set copay or co-insurance depending on the service that you're receiving. And those are the only two options when it comes to Medicare.
Okay. 联邦这个slide 讲呢，就是联邦医疗保险呢有2种选择哈，一种呢是政府提供的这个原有的医疗保险，就是我们左面看到的 Original Medicare， 那么右面的呢是 Medicare Advantage Plan， 它是由政府授权的商业医疗保险公司提供的保险计划。Original Medicare 这个原有的医疗保险呢，它包括 Part A 和 Part B， 那么就像我们上次讲到的 Part A 呢是医院住院的护理，然后 Part B 呢是主要是支付一些家庭医生的费用。那么如果你需要药物保险的话呢，那你需要买 Part D for Dave， 就是这个左面的下面第2行的这个框框 Part D Prescription Drug Coverage， 因为这个 Original Medicare 只 cover 只支付 80% 的医疗费用，那么有很多人呢也会买这个 medical 的 supplement insurance， 就是我们通常讲的这个 Medigap， 这个呢是一个补充差额的保险，也是由商业公司来提供的。那么这个保险呢，它是主要就是支付 Medicare 不承担的一些项目，到底就是这个 Medigap 会给你支付多少呢？是要根据看你具体的买的是哪一种。右面的这个 Medicare Advantage Plan， 就像刚才我们讲的，是由政府授权的商业医疗保险公司提供的保险计划。那么这个保险呢是综合了，你买了这个保险的话，这个保险其实就是已经综合了 Part A 和 Part B。一般来讲的话呢，你买这个 Medicare Advantage Plan 呢，它也会包括 Part D， 就是药物保险。
Alrighty. So like I mentioned, Medicare Part A covers hospital service, which includes inpatient hospital care, skilled nursing facility care, home health care, and hospice care.
OK， 这一章呢就是说Part A 的承保项目和服务哈。第一个呢 inpatient hospital care 呢就是住院的护理 ，skilled nursing facility care 呢就是专业护理机构哈。那么 home health care 的话呢就是家居的一些医疗保健 ，hospice care 呢就是临终的护理。
Part B, it's outpatient care, so that includes doctor visits. Sorry about that. Doctor visits, preventative services, diagnostic tests. It includes your diabetic testing supplies, durable medical equipment, limited ambulance services. So Part A is hospital, Part B is outpatient, and all the other services that you would receive outside of a hospital.
OK， 那这一章呢就是比较详细的介绍这个 Part B 的承保项目。第一行呢 outpatient care 就是家庭医生，然后呢还有预防性的服务，心理健康的服务，诊断测试的费用啊，糖尿病啊，还有一些比较有限的一些救护车的服务，假肢啊，还有耐用的一些医疗设备。
So, Part A, if you've worked 10 years or 40 quarters, is normally free. However, Part B, everyone has to pay premium. The current premium for the year 2022 is $170.10. If you have a higher income, they do calculate it. They calculate it in, and then they will increase your premium. So based on where you land, it will determine the actual amount for the premium. But generally speaking, most people are charged $170.10. There is an annual deductible of $233, and that's the same for everyone, regardless of income. And it's so this pays 80% of the service, and then the 20% co-insurance would be picked up by the Medicare.
OK， 那么这一章呢，就是讲这个Part B 你需要付的保费哈。Part B 呢，每个月呢你需要付170块1毛，这个是标准的每个月的保费。那么当然了，是根据你的收入的高低，如果你的收入比较高的话，很有可能你会付更多的那个每个月的保费。第二栏呢，它是 deductible 呢，就是在保险公司付款前呢，你自己要付的部分233块。那这个233块呢，是针对所有的人，跟你的 income 是没有关系的。然后最右面的它这个 copay 和 co-insurance 就是承保人需要承担的这个百分比哈，insurance 公司呢会付80%，那么你个人呢要承担20%。
So how I mentioned, Medicare Part A covers hospital services, and Part B covers doctor services. So we need to discuss what original Medicare does not cover. At this point in time, it does not cover any dental care, whether it's preventative or comprehensive dental care. It does not cover routine vision or eye exams related to prescription glasses. It does not include any hearing services, long-term care, or cosmetic surgery. There are some exceptions. So for vision, if you have cataract surgeries, as an example, then they would pay for a pair of glasses. But generally speaking, they do not cover vision. They don't cover dental, and they don't cover hearing.
那么这一章呢是讲 Medicare 的不承保的这个服务哈。一般呢，你的常规的牙医检查呀，视力检查、配眼镜啊，或者听力检查呀，这些助听器啊，包括这个长期的护理啊、整容手术呢，都是不包括的。当然了，你如果有那个白内障啊，这些它还是 cover 的哈，还是会支付的。但是就是这些常规的这些牙医、视力和听力的这些都是不包括的。
So, if you choose original Medicare, you have to enroll into a prescription drug plan. And so currently prescription drug plans are sold by private insurance companies. To have that, you have to be enrolled in either Part A or B, and you have to stay with having Medicare Part A or B. Currently in this year, there's 21 plans available throughout Connecticut. Each plan has a formulary list, which tells you what medications are covered. And if, let's say, your doctor prescribes a new medication and it's not on the list that they already have for that year, generally you will have to pay out of pocket for that one. The only option is if your doctor will advocate for you and send a prescription drug plan an appeal or pretty much advocating that you need this medication so that they will cover it. And that is Part D prescription drug coverage.
那这一段呢讲的是这个药物险哈 Part D 药物险呢也是商业保险公司提供的哈，在购买药物险之前呢，你需要登记 Part A 或者是 Part B。Paula, I'm so sorry, I just have a question. Before you purchase a Part D, must be enrolled in Medicare Part A or Part B or Part A and Part B?
It could be either. So most people have both, but it could be that you have either or.
Okay.
But generally, let's say a person, you'll translate it, a person is working and their employer is offering them health insurance, they can have Part A and they can have a Part D and just not enroll to Part B.
Sure.
But okay. the minimum requirement is having at least Part A or Part B.
Okay, thank you. 所以在购买这个药物险之前呢，你必须要登记就是Part A 或者是 Part B， 你要有其中的一项你才可以买 Part D 这个保险。那么康州呢，目前就是今年哈有21种的药物险计划。当然每一种计划呢都覆盖不同的处方药。如果你的医生给你开了今年新出来的处方药，不在你购买的计划的覆盖范围之内呢，那这个处方药的话是需要你自己付款的。当然你的医生也可以向保险公司提交，就是申请例外的这个上诉哈，看能不能这个 insurance company 这个保险公司帮你来支付这个新的处方药的费用。
Like I was mentioning previously, Medicare Part A and Part B only cover 80%. So the 20%, what will happen is if you do not pick a Medigap supplemental insurance plan, you're responsible. So people will enroll into these plans to pick up the 20% that's left over that's not covered by Medicare.
那么像刚才我们讲的这个原有的这个 Medicare 呢是支付80%的费用，你自己是需要承担20%的费用。那么有些人呢，比如说他的医疗费用比较高，他的身体不是很好，那么他每年需要自己承担的20%的这部分呢，金额比较大，那他就会考虑去买一个这个差额的保险啊，来帮助他来支付这个20%的部分，就是到底是多少比例，20%的里面的多少比例的话，看你买的这个计划而定。
Medigap plans, like Part D plans, are sold by private insurance companies, and they're classified by groups, are classified into groups by letter. So you'll have letter plans from A, D, F, G, K, L, M, N. Generally speaking, those who are under 65 and are in Medicare, it's due to collecting disability. And they will only be able to enroll into A, B, C, or D. So there are specific lettered plans for people over 65. And if you're under 65, you're only eligible to enroll into specific lettered plans. There are some plans that are not available to the general public. There are people who are grandfathered in. So if you were newly eligible for Medicare, or you turned 65 before the 1st of January of 2020, you are able to enroll into Plan C and F. If you turn 65 after the 1st of January 2020, you won't be able to. Each of the standard Medigap plans must offer the same basic benefits. For example, Part A coinsurance must be covered. Part B, the 20% coinsurance must be covered. And what that means is, if you pick letter plan D, regardless of which insurance company you choose to purchase it from, it has to cover the exact same thing in the exact same fashion.
OK，这个 Medicare，Medigap 的 plan 呢，是一个商业保险公司提供的哈，那么这个呢叫做差额保险，一般呢它有这个计划，从 A 到 D，A B C D，然后呢 FGKLMN 就是不同的这个计划，65岁以下的残障人士呢只可以买的计划 A、B、C、D， 其他的这个团都是不可以买的。那么在这一些计划当中呢，如果你是1月1号2020年的1月1号之后，你才可以就是你才65岁，可以购买 Medicare 的话呢，你是不可以买计划 C 和 F 的。C 和 F 呢，是比较老的计划，现在就是对新登记 Medicare 的人，2020年1月1号以后新登记的人呢是不符合加入的哈。每一个这个差额的保险计划承保的服务呢，都是不一样的哈，这个保费呢，也是不同的。
So I'm just showing you the supplemental chart. This is from 2021. I'm going to click this link and it's going to bring me to the 2022 Medigap plan. So give me a second. Can you guys see the chart?
Not yet.
Not
Still
yet?
Loading. Yeah, still loading.
Okay, just let me know when you can see it. You still can't see it?
No. Can other people see it? I cannot see it.
Can you see it now?
Okay.
Can you see it now?
No, I can still see your pop-up.
I'm gonna try this again. Can you see it now?
Yes.
Alrighty. So this is the 2022 standard Medicare supplemental insurance plans, the ones that are offered in Connecticut. So like I mentioned, on the right side, you can see all the different private insurance companies that offer a type of lettered plan of supplemental insurance. Then, as you can see over here, it tells you the actual lettered plan by the letter. And as you go down, you see the monthly premium of each. So you can see that Anthem, for example, offers a letter plan A, G, N. If you were eligible for Medicare before the 1st of January 2020, a letter plan F, and then you just look at the premium amount.
Good. OK， 那么这一张呢，就是我发到我们的那个微信群里面的这张单子哈，我说你们大家给save 一下下。这一张是2022年，就是最新的啊。你从左面一栏，你看到这些保险公司，就是2022年Medigap 只有这些公司才提供 Medigap。所有的那个提供 Medicare 的这个公司都在这个地方，然后有他们的电话号码。这个第2行就是灰颜色的这一栏哈，你看到 A B D G High Deductible K 这一行呢，就是它不同的保险计划。那么你再往右面看 C3 F High Deductible， 这个就是在2020年1月1号之前可以买的，2020年1月1号之后呢，就是不可以买的。那么刚才Paula讲的，就在每一个计划下面，每一个公司的价格都是不一样。打个比方 ，A 计划这个 Anthem 它是1007块9毛4的，然后 Signal 是315块1毛6。那么有什么区别吗？他们覆盖的这个服务项目是一模一样的哈。 我们可能有的时候会觉得价格高一点会不会服务好一点？不是这样子的。那么你选，比如说按照你个人的要求，你选哪个计划，选好了以后，你就到这些计划下面看哪一家公司的价格最便宜，就去选这家公司的，因为他们覆盖的这个服务都是一模一样，没有任何区别的。
This is just an explanation of actually what is covered by each lettered plan. In the benefit chart, you can see all letter plan A's, regardless of whatever health insurance company is offering it, must cover the Part A coinsurances, the Part B coinsurances, the hospice coinsurance, and the first 3 pints of blood. But if you compare it to letter plan G, it offers a little bit more coverage. But each company that offers letter plan G has to offer all of these. Not one can opt out of that. And that is up to you to decide which company you want to go with. The premiums do vary. Some are more expensive, some are a little bit more affordable, and you would just have to call the company directly to enroll. But that's how supplemental insurance works. They cover the 20%, and then they explain to you in detail what other extra benefits could come along with the supplemental insurance.
那么你怎样去选择哪个计划呢？到底是选择 A 还是 B 或者 D 还是怎么样？那么你就看它这一张表，它就非常详细的列举了 A 计划，就是你对比它左面的这个 benefit 的这个详细的介绍，你来选择。你看这个 A、B、C、D 所有的计划，它都覆盖。第一栏就是如果你住院的话，那么我来看一下啊，OK， 就是如果你住院的话，你有这个 Medicare Original Medicare， 就是原有的这个联邦保险的话，你自己不是要付20%吗？那么如果你有这个差额保险的话呢，那这个差额保险就会帮你支付20%这一部分住院的费用。那么 Part B 呢，当然也是20%，本来你要付20%，那么这个 A 计划呢就帮你全部支付了，A、B、D、G 都帮你支付了，K 计划和 L 计划呢按照不同的比例来帮你支付。那么这张表就是就可以帮助你就是决定选择哪个最符合你自己的个人的实际情况。
Oh, okay, so let me just switch what I'm sharing. Okay, we're back to the presentation. So that's original Medicare, right? You have Part A and B. You add Part D and a supplemental insurance. The pros of Medicare, original Medicare, you have the ability to visit any doctor or specialist across the country who accepts Medicare. It's readily accessible. And what that means is if you are from Connecticut and you have Medicare and you have to visit family in Florida, that will be covered out of state. It follows you throughout the entire country. They note that while it only pays 80% of the service, you have the option to buy or purchase a Medigap to pick up to 20%. The health decisions are made by the doctor, and you don't need any referrals to visit a specialist. As long as they take Medicare, then it's okay. The cons of that is the fact is it does not cover dental, vision, hearing at all. There are copays and coinsurances, and you have to have a 3-day stay in the hospital before Part A covers any skilled nursing facility costs. And you have to be officially admitted and not under observation.
OK， 这一章呢就是讲这个 Original Medicare 的优缺点哦。 就是原有的这个 Medicare。它的优点呢，就是你不管到这个美国的哪个地方啊，它只要这个医生是accept 这个 assignment， it's called accept assignment, right?
Yes, it's called assignment. As long as the hospital or doctor accepts Medicare and accepts assignment, you can go there.
OK， 所以并不是所有的医生哈，就是你要去就医前呢，你需要问一下这个医生是不是 accept assignment， 一般都是也可以的，但是你需要确定有的医生也是不可以的，不接受的。那么你美国哪里都行。以前有人问，如果我从康州我换到那个另外一个州，怎么办？没有关系的，他都可以哈。还有一个呢，就是我们刚才讲的，你有 original Medicare 的话，你可以买 Medicare， 就是这个差额的这个保险，你可以买。然后呢，就是你可以去看直接就去看专科医生哈，不像有的时候我们要去看专科医生的话，我们需要家庭医生要写一个条子，我们才可以看。但这个original Medicare 的话是不需要的，你直接去，而且你也不需要有一个we don't have to have a primary doctor, right? If we have original Medicare.
When you say they don't have to have a primary doctor, like what do you mean? You can always have a primary doctor.
It's not required, right? Because I know some of the.
No, and if you had to see a specialist, your primary doctor doesn't have to refer you. But most people have a primary doctor. You don't have to. If you don't have to see a doctor, then you don't need to keep a primary doctor to have Medicare.
Yeah, because some of the insurance are required to have a primary doctor. So I just want to be clear.
I'll verify that, but I don't think you have. I don't think it's a mandatory requirement.
OK， 那这一点呢，我们要去在包了时候要再确定一下是不是要这个 primary doctor family doctor 的话，可能是不需要的，但是我们会要再去确定一下。但是你是可以直接去看专科医生，不需要家庭医生来帮你写条子。但是它的缺点呢，就是你常规的牙医啊、眼科医生啊，然后听力啊这些，它都是不包括的。那么这个 original Medicare 呢，你也是需要支付这个copay 和 co-insurance， 就是20%。那么还有一个呢，就是最后一点的这个缺点呢，就是你需要3天住院，3天住院以后，如果你去专业护理机构呢，这些费用 Part A 才会来支付。那么他的3天住院呢，一定要注意，在我们中国的话，可能你在医院里面就是住一晚上，你就觉得你是住院了哈。但是的话，他这个地方是不一样的，你可能会在医院里面住了3天，他都不算是真正的住院哈，他可能是你就是观察。就是你观察了3天，这个观察3天是不是真正的住院？你需要就是区别，就是他一定要 admit 你，就是在医院里面住3天才是符合的。
Alrighty, so now we're going to learn about Part C, which is called Medicare Advantage. So it's a little confusing. While you might, I'm so sorry, click the button. While you might be enrolled in a Medicare Advantage plan, you are still always enrolled into Medicare Part A and Part B. If you elect a Medicare Advantage plan, you keep your original Medicare, and you still have to pay that Part B premium. It's $170.10 every month. These are also operated and ran by private insurance companies that are contracted through Medicare. There's 2 types in specific: HMOs, which stands for Health Maintenance Organizations, where you have to stay in network when you are visiting providers or doctors. And then there are PPOs, or they're preferred provider organizations, where you're allowed to see doctors or providers in and out of network, but if you are electing a doctor out of network, you're paying higher copays. There are special need plans, and that's for those who are for people with specific diseases, or certain characteristics like living in a certain institution, like a nursing home, are eligible for both Medicare and Medicaid, or those who are suffering from specific chronic disabling conditions like diabetes, end-stage renal disease, HIV, AIDS, and chronic health failure or dementia.
那这里的这个Part C 就是我们讲的 Medicare Advantage Plan 哈，就是它是商业保险公司提供的优势计划险啊。当然商业保险公司提供的这个优势计划险呢，它也是需要遵守 Medicare 的规则的。就是 Medicare 就 Original Medicare 提供的这些覆盖的这些服务呢Medicare Advantage Plan 呢也是需要同样的是需要覆盖这些费用就是服务的。那么你在Paula, I'm a little bit confused, but can you explain the first line again? Must keep a Part A and a Part B active. Does that mean if we want to buy Medicare Advantage that we have to have a Part A and Part B, right?
You do. You keep it, it's active while you have your Medicare Advantage plan.
Okay.
You never disenroll from that.
Okay. 那么这个优势计划险呢，就是如果你一旦买这个优势计划险呢，你必须这个有 Part A 和 Part B， 然后呢，你即使买了这个优势计划险呢，你 Part B 的保费啊，就是我们刚才讲的170块，还有一个零头我不记得了，要去看再回去看一下。那这个每个月的保费你还是一定要交的。然后这个 Medicare Part C 这个优势计划险呢，一般都是包括这个药物险的哈。有3种，在这一个 Medicare Advantage 下面呢，有3种险种，一种叫 HMO， 一种是 PPO， 一种是 Special Needs Plan。HMO 呢，只能在网络内的服务点就医。网络外的呢就需要自己付钱，它可能会比较便宜一点点，但是的话呢，你医生给你选择的医生的范围就会要小一点。PPO 呢你哪里都可以去就医，网络内的服务点会更便宜，网络外的呢会贵一些。Special Needs Plan 呢是特殊需要的一个计划哈，专门提供给患有特殊疾病的人群，以及符合规定的一些低收入的人群等等。比如住在医院住在老人院的老人啊，或者是住在家里的老人，但是他需要长期的老年护理，比如说他瘫痪在床啊，但他决定不去老人院，他在家里面有家人护理。那么还有一些低收入的人群，还有一些特殊疾病的，包括糖尿病啊，晚期肾病啊，艾滋病啊，老年痴呆啊，还有那个慢性的心力衰竭病这一类的。
So Medicare Advantage plans Medicare Advantage plans offer and provide basic benefits that Medicare Part A and B cover. All the plans have a maximum out-of-pocket limit on yearly cost sharing when it comes to A and B. The current range is from $3,400 all the way up to $7,000. This is the $10,000 of 2021 yearly amount before the plan covers 100%. And that does not include any monthly premiums or any drug costs. Most plans will cover medication, and they will also have some additional benefits, like dental care, vision care, hearing aids, some type of transportation, nutrition/meals, home care services, gym membership, and adult daycare, and over-the-counter benefits. They'll send you a booklet every quarter with the option to order vitamins and other types of supplies that are considered over-the-counter through their insurance.
Paula, did you change the MOP limit?
I thought I did. I still have the 2021 MOP limit. It's $7,000. It's $7,000.
So 3,400 to 7,000. It's for 2022, right? 那么按照规定呢，原始的这个 Medicare 承保的服务，这个 Medicare Advantage Plan 呢都需要承保，并且每年承保人自己出的医疗费用呢是有一定的限额的。那么刚才Paula讲，就是2022年，不包括你每个月付的保费，也不包括药物险的这个费用，你自己出的费用呢，一般都不，就是每一年是不超过3400到7000之间。那么为什么是一个3400到7000之间，而不是一个具体数额呢？那因为是不同的保险计划，要看你买哪一种保险计划啊。贵一点的保险计划，你可能自己出的钱就是要少一点点。如果你要是买便宜的话，你自己出的钱会要多一点点。一般的这些 Medicare Advantage 计划呢，它都会帮你支付，比如说常规的牙医呀、牙医检查呀、视力检查、听力检查呀，它还会包括就是如果你要是到医生那个地方去问诊的话，产生的一些交通费用，有的也是会帮你支付。还有就是比如说你有特殊的病况的话，你要吃特殊的营养餐啊什么，那么有的这个 Medicare Advantage Plan 也是会帮你支付的，包括家庭护理啊，远程的医疗费用啊，特别是在我们这个 pandemic 之间，现在 pandemic 期间哈，有的时候我们不到医生诊所去看，我们在网上面哈就诊这些远程的医疗费用啊，老年人的健康中心的会员费啊，包括老年看护中心的费用，有一些 Medicare Advantage 还会帮忙就是支付一部分的非处方药，但是当然了，它列出来的这一些，并不是说你买的任何一种 Medicare Advantage Plan 都会支付这个，就是也要看你买哪一种计划而定。
So here we have the pros and the cons of a Medicare Advantage plan. So first things first, unlike original Medicare, you receive your health care and drug coverage all in one plan. It's all comprehensive, all inclusive. Another pro is that they have additional benefits like dental, vision, and hearing services that's not covered under original Medicare. Some plans have premium free. While you still have to pay Part B premium, you don't have to worry about an additional cost. Some plans might not require that you have to have a 3-day qualifying stay in the hospital before they cover skilled nursing facility care. And all plans have a maximum out-of-pocket expense, so you'll never exceed that MOOP amount. The cons about this is because it is, some of them are HMOs or PPOs, you have to make sure that your doctors are in network or the facilities that you're using are in network. Some plans will require you to get a referral from your primary care physician to see a specialist. Some plans require additional premiums for the extra benefits. And you can't purchase a Medigap plan to pay for your deductibles and co-insurances. So whatever the set co-pays or co-insurances are with your Medicare Advantage plans, you have to pay for that out of pocket.
那么这个优势计划险呢，它的优缺点是什么呢？它的优点当然就是你买它一个计划的话， 你不要像这个 Original Medicare，你要分开买 A、B、D， 它这个一个险就包括了所有的，对吧？然后呢，它这个保险呢，就是支付你的常规的这个牙医啊、视力和听力的这些费用，检查的费用，有一些优势计划险呢，它的月费呢是免费的。当然哈，你这个 Part B 的170块钱的这个月费，你不管你是 Original 的还是 Advantage 吧，你都是要出的。但是呢，有的优势计划险呢，在你出了这170块钱之外呢，有的优势计划险还需要你就是付更多一点的月费，但有的呢是不需要你付任何钱，是不需要增加费用的。还有一个呢，就是我们刚才讲到 Original Medicare 的话呢，你需要住院哈，医院里面让你住院3天，你才可以得到免费的去这个 skilled nursing facility 专业护理的这个机构去住在他那个地方的话，那么你的保险公司呢才会付钱。但是呢，就是你这个优势计划险的话的，有些的话是没有这个要求的，你可以你直接去这个 skilled nursing facility 的话，它也是可以帮你支付的。然后呢，它还有一个优势呢，就是不像是 Original Medicare 20%，无论是如果你一年的总费用是5万块钱，20%的话，你就要付1万块钱，对吧？它是没有一个上限。但是呢，这个优势计划险呢，它就是有上限的，它每一年就像我们刚才说的3400块钱到7000块钱之间，它是有个上限的。那它的缺点呢，就是它有这个网络哈，你必须要在它覆盖的网络之内去就医，你不可以像 Original Medicare， 你可以全国范围内只要这个医生 accept assignment， 你哪里都可以去。但是这个呢，就是有一个网络，它有规定，你只可以到哪些医生、哪些facility 去。那么还有一个呢，就是像我们刚才讲的专科医生。有些计划的话，你是不可以直接去看专科医生的，你必须要由你的家庭医生来写单子，你才可以去。那么它还有缺点呢，就有的计划呢，它就月费会比较高。如果你想要它覆盖的服务项目更多的话呢，你可能会要交比较高的月费。还有一点呢，就是你的差额险它是不可以的。这个差额保险 Medicare 只可以 Original Medicare 购买，这个 Medicare Advantage Plan 你是不可以购买的。
So those are the pros and the cons of Medicare Advantage plans. Lots of people also see commercials maybe on TV during game show ads, and a lot of them, I will say, you can get a good at Medicare Advantage plan, but we do implore people to call us first. Our job as choices counselors are to help you guys with plan comparisons. So we will care about both. We will compare both prescription drug plans and original Medicare plans to a Medicare Advantage plan. So that way you can make the proper decision when it comes to your health care.
I'm sorry, I was looking at the question on the chat box. I didn't pay attention.
No worries. All I'm saying is, as choices counselor, our jobs are to do plan comparisons. So if they see ads on TV, you can call them, but we suggest that you don't. If you call us, we can look at what your prescription drug plan, what your prescription list is, and do a thorough research on what options are your best options, and then present them to you so you can make a informed decision. So that's all we ask, is that while you might see radio show ads or TV commercials, give us a call first and check in to see what your options are, and that way you can pick the right one.
OK， 那么他呢就是刚才在介绍他们这个中老年服务中心的这个服务呢，他们提供的服务当然都是免费的哈。如果你在选择这些保险，那么多的保险，哪个险是适合你呢？跟每个人的个人情况都是不一样的。有的人说，哎，这个险比较好，但是这个险不一定对你不一定是好的。那么如何来对比？如果你有这方面的需求呢，你可以打电话到他们这个中老年服务中心，一会儿我们可以把这个电话给你哈。康州有五个分部，他们呢是可以帮你来做对比的，也可以教你怎么样去做对比。一般呢，你到那个 Medicare.gov 的话呢，你可以自己建立一个账户，然后进去了以后呢，你可以自己找符合你自己。如果你不愿意呢，他们也是用同样的方法，就是帮你来找。一般他都会按照你实际情况，你吃哪一些，平时都要吃哪些处方药，你把这些药的名字和剂量都告诉他呢，他会按照你的个人的情况来帮你找出几个最适合就是价格最优惠，然后最适合你的这个保险，然后供你来选择。但是当然他们不会给你特别的推荐某一个保险公司或者是某一款保险计划，他们是不允许的。他会根据你的情况，就是他的这个电脑会生成，比如说最符合你的，按照你提供的情况会生成几个这个保险计划，他会把这些信息会告诉你。
So on this slide, I have different resources that you guys can use, but the one that I really want to point out is the first one, which is our phone number. So you can call the Western Connecticut Area Agency on Aging. Our number is 203-757-5449, and ask to speak with a choices counselor, and we will direct you and help you throughout your whole entire journey while you're on Medicare. I also have included, the Medicare phone number, Social Security's Administration's website, and the Center for Medicare Advocacy. But the one that I think is really important to have is our phone number. And like I said, you can call that number and ask specifically for a choices counselor.
那么这一章呢，就是他列举了一些就是可以可以提供帮助的一些网站哈。第一个呢，就是他的 WCAAA 的这个官方网站，203-757-5449呢是 Western Connecticut Area Agency on Aging 的电话号码，然后下面的呢是 choices， 这个有的时候大家可能会有一点点就是 confuse 哈。choices 呢是这个 Area Agency on Aging 下面的一个就是一个服务项目哈。它这个 Area Agency on Aging 它有很多的服务，choices 呢就是专门 Medicare 这一块的，只是一小块。它还有其他很多部门，就是提供很多其他的免费的服务。那么后面呢还有一些其他的Medicare.gov 啊，Social Security Administration.gov 这些网站，如果你要有时间去去学习的话，你都可以得到很多关于 Medicare 方面的信息。
This slide, again, just reiterates who you should be calling, which is us, but we're also not taking in-person appointments because of COVID-19. We are providing help via phone or Zoom. So if you give us a phone call at 203-757-5449, and our extension is 134, we'll be able to help you over the phone, or we can set up a Zoom meeting. And down here in the link, I'll put it in the chat, is a Survey Monkey that we would hope that everyone could fill out, so that way we know how well we did on our presentation.
那么这个他们这个机构呢，因为现在的 疫情期间啊，他们是不对外开放的。但是如果你打电话打下面这2个电话，可以跟他们约电话或电话对话，或者是 Zoom 的 appointment 都是可以的。他们这个机构呢是非营利性组织，他们不推销任何的产品，他们也不卖产品的，他只是给我们这些居民提供资讯的服务。Medicare Open Enrollment Period 10月15号到12月7号之间呢，就是你可以如果是你想换你的这个优势计划险啊什么，在这一段时间里面都是可以来更换啊。然后你想要买这个 Part D 的话，也是可以在这个期间来购买。然后他说下面有一个survey 哈，就是调查表，如果你们愿意来填写这些调查表，让他们知道他们这个讲座到底对大家有没有作用的话，他们也非常感谢。
Alrighty, so I'm going to stop sharing my screen. And now it's the portion for open floor for questions. The questions will be directed to my colleague, the wonderful Daryl Willenbrock, who has a lot of information. So Lee asked Daryl her questions.
Okay, so now it's 7:58. We have a couple of questions here. One is our Advantage plans nationwide?
Are they nationwide? Is that the question?
Yeah.
Buy Advantage plans throughout the country. However, unfortunately, when you buy them, they are generally limited to specific areas. If you buy them in Connecticut, you generally have to go to doctors within the state of Connecticut. They may give you leeway to go into New York. Some of them have what they call a passport, which lets you go to frequently traveled states. For instance, Florida. A lot of people go to Florida for the winter. So you might be able to get a passport, which will let you use the Advantage plan in Florida and in Connecticut. But if you leave or move out of the state of Connecticut, you need to change your Advantage plan. It won't travel with you.
OK， 他呢就是说这个 Advantage plan 呢，怎么定义它这个 nationwide 呢？就是你在康州买，那么基本上它的这个网络就是在康州州内的，当然也有特殊情况，比如说你经常冬天的时候你要到南方去过冬，那么它有的计划呢，它也是可以在这段时间里面，你也可以到这个南方的某一个城市，它也有一个覆盖范围，你可以到那里去就诊。Daryl, I think emergency care also cover, right? If you go to
emergency care is covered in any state. If you took your plan in the state of Connecticut and you're on vacation in Colorado and you have a heart attack, the state of Colorado can treat you and the plan will pay them. What can't be done is you cannot stay in a Colorado hospital for continuous service. So once the state has leveled you and stabilized you, you need to come back to Connecticut for treatment.
OK， 那么他就是说，你这个急诊的费用哈，如果你这个计划是在康州买的，那么你到了另外一个州，你突然之间有紧急的身体出现紧急的问题，你要去挂急诊的话，那么这个急诊的费用是支付的。当然你急诊看完了以后，你还要继续看医生的话，那么你就要回你比如说你康州买的保险的话，那你要回康州来看医生。下面一个呢是for Medicare, who is eligible for United Healthcare Group Plan?
United Healthcare, which plan?
Group plan. Oh, okay. So
He's talking about the AARP one, Daryl.
Yes.
Okay. Well, it depends on I mean, most people are eligible. I just wanted to point out one thing when we talk about supplemental plans. You're going to see all different prices. And when you're looking at, we'll say a plan G, for instance, if you see one is 600, one is 300, one is 200, they're all the same. You're not getting any additional benefits for paying more. The price is based on what they advocate for and the number of people enrolled in the plan. There are plans that are limited to younger disableds. Generally, that's A, B, C, and D, I think. And then the rest are 65 and over.
Can individual buy the group plan?
What?
For example, as an individual person, can I buy the group plan, like United Healthcare Insurance, AARP?
Oh, the group, yes. Yeah, generally you do have to take out a membership in AARP, but I think it's like $50 a year.
Okay.
But yes, you can buy the group plan. And generally AARP's Medigap plan is cheaper than most. And the other thing I want to just say, the big thing with Medigaps and Medicare Advantage plans is Medicare Advantage plans do not do well in long-term care. Nursing homes don't like them. And generally, when a person gets into a nursing home, somehow they have to get over and transfer onto a Medigap. Because we always seem to have clients that have trouble when they get into a nursing home if they're on an Advantage plan, because the plan is dictating you need to leave. And the nursing home may say you're not ready to leave. So we find ourselves constantly appealing those plans. So I know Advantage plans are not the best buy if you have a lot of illness, if you have you see a lot of medical doctors. I don't recommend Advantage plans for people that have serious medical problems. They're great for people that are generally healthy and maybe only see a doctor once or twice a year. But if you are in a situation where you need some kind of ongoing treatment, I personally do not recommend Advantage plans.
Well, okay. First, to purchase the group plan, that the people have to be the member of AARP. Is that correct?
Generally, they tell you to be a member, but the membership is cheap.
OK， 所以呢，回答刚才这位朋友的提问呢，如果你想要买这个 United Healthcare Insurance 的 Group Plan 呢，你需要是 AARP 的这个 member 啊，但是这个他说了 member 费呢是非常低的。另外一点呢，他说如果身体不是很好的情况下呢，是不建议买 Advantage Plan。但是I'm a little bit confused. I'm so sorry. Now it's 8:05. This will be the last question, but I'm just a little bit confused because we talk about Medicare Advantage Plan. There is the MOP is a MOP limit is a 3,400 to 7,000. That's right. The maximum that you
out of pocket,
right? But for instance, if this person is not healthy and the medical bill is 50,000 a year, I have already Medicare, 20% will be $10,000. It will be much more than 34 to 7,000.
Right, but what happens is there's a lot that's not included in that 7,000. So, for instance, I'll give you an example. I had a gentleman that was on a Medicare Advantage plan for several years, and it worked very well. It was a zero premium plan. He did not go to the doctor much. But then in the 4th or 5th year, in October, so he hadn't met any maximum, he got prostate cancer. So he had to undergo radiation therapy, which was $1,900 a month. So at that point, he had to pay $1,900 for October, November, and December out of pocket to cover the radiation therapy. So you're right. I mean, he hadn't maxed out at all, but it depends on your financial services. And
Okay.
the other part, the biggest problem with Medicare Advantage plans is they're dictating what's going on with your treatment, which is a little different than when you're on original Medicare A and B and a supplement. Because when you're on original Medicare A and B, Medicare isn't saying you shouldn't do this or you shouldn't do that, and the supplement isn't. But many times it's the Advantage plan that's telling you what you can and cannot do. That's one of the biggest problems we have with Advantage plans.
So that you mean Medicare Advantage plan, lots of stuff that you do that is not covered on the
Right. They
Medicare
don't
Advantage plan?
Original Medicare doesn't intervene with your health care. I mean, original care gives you A and B, and if you buy AARP supplement and you go to the doctor and the doctor says you have to do this, everybody goes along with it. When you're on an Advantage plan and you go to the doctor, the Advantage plan has the right to say, all right, we don't think you need that service, or we're not going to cover
okay,
that
now I
service.
got it.
That's the biggest problem.
Okay. Yeah, got it. 那么刚才呢，我们就是讲到Medicare Advantage Plan， 它每一年你要自己出的钱呢，除了月费药费它这上面写你最多出3400到7000块钱。那么就是一般情况，你这么一看的话，就觉得这个 Medicare Advantage Plan 是非常好的哈。如果你要对比你的如果每一年你要出医生要收你5万块钱，20%的话，那就是1万块钱。你要对比一下 Original Medicare， 你就会觉得这个 Original Medicare 的费用我要出的非常高。但是第二个就是刚才提到一点，不能这么看，因为 Advantage Plan 的话，很有可能很多你就医的项目的话，保险公司是不 cover 不支付的，不像是 Original Medicare， 你去看哪一个看哪一方面的，只要医生说你需要去看，那你就是可以去看的。那 Medicare Original Medicare 就帮你支付80%，但是你如果有Medicare Advantage Plan 的话，就不是这样子。他们的 insurance 公司可以决定有些你是不需要的就诊。所以还是要be smart 哈。如果是根据每个人的情况，很有可能如果你要是医疗费用比较高的话，关注一下 Original Medicare 和这个差额保险 Medigap。All right, it's 8:10 now. I'm so sorry, Dale and Paula. Let's end for now, OK? 非常感谢大家的参与哈，我们下期再见。
Come back next time.
Thank you, everybody.
Thank you.
Good night.
Good night.
Night, Daryl. Night, Lee.
Night, Paula. Night, Lee. Have a good evening.
Thank you, everyone.